Hello and welcome to World Earth Day 2025. I'm going to discuss how a lifestyle medicine approach can save the planet. Better for people, patients, practices, professionals, populations and planet simultaneously. My name is Dr. Matt Sawyer and along with Dr. Maria Goddard, we are co-chairs of the British Society of Lifestyle Medicine Planetary Health Special Interest Group. Just before I begin, to let you know that the British Society of Lifestyle Medicine Annual Medical Conference 2025 is in Brighton this year in September and tickets are available. 4.5 billion years ago, when the Earth was being formed, the average temperature on the planet was about 80 degrees centigrade. Around 600 million years ago was the last ancient ice age. Called the Cryogenian period, this is also known as Snowball Earth. During this time, ice covered large swathes of the planet, with glaciers blanketing huge expanses of the northern hemisphere, and ice was present even in equatorial regions. During this period, NASA have calculated that average global temperatures were closer to minus 10 degrees centigrade. The planet has been through far worse. We have not. This emphasises that it is not the planet which is in danger, it is us, as we humans are in danger from climate crisis and ecological collapse. What would an environmentally sustainable future mean to healthcare? Well, the Cambridge Dictionary defines sustainability as the quality of being able to continue over a period of time. For mankind to continue, we must live within our planet's means. To continue to live, thrive and survive as a species, we need to take a step back from breaching planetary boundaries. For example, we cannot continue to take more resources from the living world than it can replace. We cannot deplete the ozone layer, acidify the oceans, or continue to pollute the air, soil and water. Simultaneously, a safe space for humanity is desired, with access to good quality food and nutrition, clean water to drink and clean air to breathe, fulfilling employment and adequate income, with peace and justice, social equality and gender equity, with good quality, suitable housing and plentiful clean energy. I think if we look across the globe currently, we know that there is a shortfall in this social foundation for humanity for many. Planetary boundaries are really a framework to describe those limits of where the impacts of human activities are occurring within the Earth's system. Well, how are we doing? Are we keeping within our planetary boundaries, the environmental boundaries which keep us safe? Unfortunately, collectively, we are moving towards irreversible collapse. There are interactions across all areas of the natural world, whether in the soil beneath our feet or the blue waters of the oceans. And it's these myriad of codependencies which are essential for our survival. We ignore the evolutionary process that have occurred over millennia to produce a balanced living world at our peril. We can see that we have crossed more planetary boundaries over the last 15 years. The health, well-being and livelihoods of humankind are dependent upon nature, and yet nature is under more threat than ever. It is also recognised that climate change poses the most profound threat to the health of the nations. There are many aspects of environmental harm that are currently occurring, but the one which contains every single other issue is climate change. The climate crisis is not just about rising concentrations of invisible gases in the atmosphere. It affects the social foundation of humanity. Whether extreme weather events affecting housing, infrastructure or food yields from farming, it has physical and mental health impacts and increased risks of death. It affects access to clean water we drink and the clean air that we breathe. Sarah Birch, one of the lead authors on the last Intergovernmental Panel on Climate Change report, said that we cannot reach our broader sustainability goals of a vibrant nature, clean water, no poverty and healthy communities if we don't address climate change. The 6 pillars of lifestyle medicine are well known to many. However, the links to planetary health may not always have been identified. We know the 6: mental well-being, which can help use proven techniques to reduce stress and help people with mental health problems. Practitioners can support people to find purpose in life and improve health through connection with nature. Physical activity. We know lifestyle medicine supports people to choose the ways in which they can incorporate more physical activity into their lives and reduce the amount of time sitting down. Healthy eating. Lifestyle medicine supports people to reduce consumption of ultra-processed food and has the knowledge and the skills required to follow healthy eating patterns of a person's own choosing. Lifestyle medicine supports people to achieve good quality sleep and avoid the behaviours which can impair sleep quality. Healthy relationships can be supported through lifestyle medicine to help develop and sustain both healthy and meaningful relationships and increase social connection, which in turn can reduce stress and promote physical and mental health. And minimising harmful substances. Lifestyle medicine supports people to stop smoking, reduce excessive alcohol consumption and addictive substances and behaviours such as gambling and excessive internet media use. But I'm going to highlight how some of these links and some of the benefits and some of the ways that lifestyle medicine can save the planet. One of the approaches is to think about the 4 principles of sustainable healthcare from the Centre for Sustainable Healthcare. The first is about prevention. The second is about patient self-care. The third is about lean service delivery, and the fourth about low carbon alternatives. And where does lifestyle medicine fit in? Well, actually it fits into all of them. If we think about prevention first, in the UK there are currently about nearly 1 million people who live with dementia. It affects 1 in 10 of the over 65s. But if I ask the question, what proportion of that dementia could be avoided? And I'm going to give you the answer. Is it 0.5%, 5%, 25% or 45%? What proportion of dementia is preventable and how does lifestyle medicine and planetary health fit into this? Well, actually, 2024, there was a Lancet commission looking at dementia. And if I had a drug that could reduce the risk of dementia by nearly 50%, would you take it? Well, actually, the Lancet Commission identified 14 risk factors that could prevent nearly half of dementias. That potential for prevention is really, really high. Imagine if we as a country or a society took dementia prevention seriously and did all that we could to eliminate nearly half of it. Well, conversely, if we're not going to do that, might that mean that we appear negligent or heartless or condemn more people and their families and society to unnecessary suffering? But how does this fit into lifestyle medicine and planetary health? Well, what we can do is look at the 14 risk factors. And it's important to know that it is never too early or too late to address these risk factors. And even those people who've got an increased genetic risk of dementia, that risk can be modified. So these are the 14 modifiable risk factors for dementia as identified by the Lancet Commission. Well, we know that lifestyle medicine can, well, help here and, well, here as well, actually, and on air pollution. Well, what about alcohol? Well, we know that alcohol is part of it and smoking is, and it has influence over social isolation and high blood pressure and diabetes and obesity. So actually, lifestyle medicine can start to impact on a lot of the modifiable risk factors for one very cruel disease. In healthcare, we can assess, influence and have impact on and treat a whole bunch of these. If we take an environmentally sustainable planetary health approach, preventing disease turns out to be good for in many different ways. For the patients and their family, for staff, reduces patient demand, reduces the need for treatments. financially makes a lot of sense, and of course from a planetary health perspective. So lifestyle medicine can really help prevent some of the cruelest diseases. And we can have a look at some of these risk factors in a bit more detail, both now and later on. So thinking about things like air pollution. Air pollution is a harmful substance. And actually, within the planetary boundaries, we have harmful substances under chemical pollution. And of course, harmful substances is more than just tobacco, alcohol, recreational drugs, and some behaviours. So within this chemical pollution sector of the planetary boundaries are some man-made novel entities. These are things like pesticides, like pharmaceuticals, like antibiotics, plastics, heavy metals, radiation, forever chemicals, and air pollution. We already know some of the names of these things, such as the pesticide DDT. We had CFCs, we had lead in petrol, we had radioactive radium paint. And then there are other categories such as endocrine disrupting chemicals or polychlorinated bipheноls, per and polyfluoroalkyl substances. These are things which we as humans are creating and are effectively polluting, and some of them are forever chemicals. We cannot get rid of them. And we know that there are some real life examples of how some of this chemical pollution is having direct human health consequences, as well as polluting the natural world and affecting planetary health. So Bhopal in India in 1984, Union Carbide pesticide plant released 40 tons of a deadly gas from a storage tank. 20,000 people were killed. Hundreds of thousands were injured. Even those that survived were twice as likely to die from cancer or lung disease or tuberculosis. More recently, Flint in Michigan, the water system pumped untreated lead-contaminated river water into taps so that people drank it. 100,000 people were exposed, including 12,000 children, and they were exposed to unsafe levels of lead, which is a neurotoxin that can impair intelligence. But it's not just about these historic events. Air pollution today is one of the leading causes of premature death globally. Of around 8 million premature deaths each year, 80% of them are directly attributed to the burning of fossil fuels. Things that we can do to make a difference is we can actually put our names to campaigns which are there to try and reduce and stop the burning of fossil fuels. Heat waves are a direct consequence of a changing climate. Those who are most vulnerable are those who are most at risk, and this includes those who have underlying mental health problems. Recent research has shown an increase in the incidence of suicide with rising temperatures, or an increase in hospital admission and attendances during heat waves. Well, what can we do? Well, our special interest group is in the process of creating infographics to help the public and patients and professionals to understand the links between planetary health, human health, and the actions that we can take. This is just one initial example of heat and mental health. When it comes to diet, there are some important elements that are contributing to a worsening climate crisis. Livestock, for example, contributes about 15% of global greenhouse gas emissions. And at the same time, high processed meat diets are linked to a host of health problems. A solution is to increase the amount of fruit and veg consumed on a daily basis. We know that this reduces the risk of some conditions such as heart disease, stroke, and some cancers. But we also have to be aware of our current baseline, that only about a third of adults and 1 in 10 children are currently consuming 5 portions of fruit and veg a day. And to make a lifestyle medicine approach even trickier to be able to implement it across all parts of society, recent studies showed that about a fifth of people were finding it difficult to manage financially. So what can we do? Well, Actually, our special interest group infographics, which are there for public, patients and professionals, will include suggestions to try and help tackle some of these things. So, for example, how can we eat healthily in a heat wave? How can we help people to be able to manage a bit better? We all know the benefits to an individual of being physically active, but there are even more co-benefits for our colleagues, communities, and the planet of being more active. Take the daily commute to the workplace as an example. Having a more active commute is great for the individual, lowers their risk of physical problems, less likely to be admitted to hospital. Also, 80% say that their mental health improves. And from a business perspective, 60% of people say that they have an increased productivity as a result of an active commute. We all want a more productive healthcare system, and I firmly believe that active commuting has a real role to play in this, and for virtually zero financial cost. But of course, it gets better than that. Active commuting reduces air pollution, less burning of fossil fuels, so the community benefits from less exposure to harmful substances, and less greenhouse gas emissions, so the planet benefits as well. And if we get it right, if we combine that knowledge of planetary health and lifestyle medicine, well, we start to see results like this. So this is where 8,000 people who were helped to take part in activities such as nature walks, community gardening, tree planting and wild swimming. And this was really the largest project in the world so far. And the results show that after taking part in the schemes, people's feelings of happiness and of life being worthwhile jumped to the near national averages, and levels of anxiety fell significantly. The project also found that the cost of a green prescription was about £500, making it cost effective when compared to other treatments. So, for example, cognitive behavioural therapy costs about £1,000. Importantly, they were able to reach a broad range of people. So, for example, 21% were from ethnic minority populations, 57% from economically deprived areas. Overall, it makes life more worthwhile. And isn't that really one of the definitions of being healthy? One of the examples is really linking together physical activity, improving mental health, and social cohesion and making relationships. Well, one of the green prescription projects was the Wild Swim project, and it did just that. This was a medication-free way of creating good physical and mental health, forming bonds between humans and the natural living world, linking with others for a support network and shared common experience. Life satisfaction up 25%, happiness up 20%, feelings of worthiness up 23% for the participants is really a great outcome. Sleep and anxiety is a big problem, particularly eco-anxiety. We know that eco-anxiety is associated with depression, anxiety, stress, insomnia, worsening mental health, functional impairment, reluctancy to have children. And we know that this is more common in climate-concerned populations, particularly among women, but also in poorer countries and in younger generations. We know that there are some standard things that lifestyle medicine can use to try and improve sleep. So maintaining the same wake and sleep times each day, keeping a bedroom dark and cool and quiet, limiting caffeine and alcohol consumption, trying to spend some time outside in the natural living world with natural light to get a decent dose of melatonin, and to keep physically active to be able to enjoy sleep better. But what about eco-anxiety itself? Well, we know that climate anxiety is rife with uncertainty, but taking actions may help you feel more in control. Talking with others, joining forces, and making lifestyle changes based on your values. Listening to concerns, validating the concerns. I hear you, and it makes sense that you're worried or angry about this. Helping direct efforts into advocacy groups and spending time with research with organisations that you can get involved in. improving knowledge about the actions and the steps that we can take to minimise our own impact on the environment, and supporting other people's decisions to make lifestyle changes, particularly within the home, and spending time in nature or with the family, or doing nature restoration, so tree planting or flower planting. And again, as a special interest group, we are producing an infographic looking specifically about sleep and eco-anxiety. The book displayed, Active Hope, is again a very useful book to try and help people to overcome eco-anxiety. Now, what would we like each of you to do? Well, on World Earth Day, and actually every other day as well, we would like each of you to be able to make a pledge, to do one thing differently, whether for you, for your family, for your colleagues, your workplace, your patients, or your community. I would like you to write that pledge down and talk to somebody else about what you're going to do and why. You can post it on social media, or you can pin it to your fridge door, but let others know why it is important to you. What sort of thing might be in that pledge? Well, it's really to show the understanding of the links between planetary health, population health, and personal health. It's recognising that a lifestyle medicine approach can improve all of these simultaneously. And it's doing so in the knowledge that if we do things differently collectively, we can make a real difference. It's also being aware that there are 50 shades of green. And what this means is that it is not a binary 1-0 black or white decision. The pledge can be that most days I'm going to do this thing when I can, when the sun shines. So when the sun shines, I'm going to cycle to work instead of taking the car. Doesn't say that you have to do it all the time. It says that you can do it when it's suitable and possible. And don't beat yourself up that I haven't been able to do this every day. Other bits of life get in the way. It's doing as much as we can when we can and not feeling guilty the rest of the time. So just to finish, who are we? Well, I'm Dr. Matt Sawyer, and with my colleague, Dr. Maria Goddard, we are the co-chairs of the British Society of Lifestyle Medicine Planetary Health Special Interest Group, and you would be more than welcome to contact either of us, and we can have you join our group. And just finally to finish, just a reminder of the British Society of Lifestyle Medicine Annual Medical Conference 2025 in Brighton. Tickets are available now. Thank you for your time.